Well, we're back with Dr. Tural, a pediatrician. Dr. Tural, first of all, are you guys ever sleeping? Because, you're telling me so often that parents should simply not hesitate to call their pediatrician when a problem slightly persists. And some problems are only hours in persisting, such as vomiting, which we're going to talk in a minute. But other ones, persisting means for a few days, such as just having a bellyache and etc. But that means those pains and those symptoms probably come, I don't know, day and night. I don't think they have a 9 to 5 type of thing with the children. So are you guys ever sleeping? Are you open 24 hours in your shop?
Yes. Well, when we're open, of course, we are there. We do deal with the problems, and then that's what we do. But after offices close, we do have our personal life too, which would involve some rest and then getting ready for the next day and then what have you. But then when the office is closed, then you would sort of titrate the symptom. Put a value to the symptom, and then a great majority of the patients are sensitive to calling for simpler problems. But sometimes a simpler symptom or problem for one mother would mean a calamity for the other mother.
Right.
Or parent. And they sometimes they do need that reassurance. And that is, you cannot sort of teach a parent or all the parents as to how to be calm and then what to do or in a given situation. And then therefore there's variation of the calls, nature of calls. Some are very sensitive, as I said. They would only call the doctor what's truly necessary, and then after our call.
Usually I assume those are the parents who, for one reason or another have a little more experience with children and know a little more what is what in terms of like acute problem, like whoa, this needs to be handled now. Okay.
Right. Yes.
But what about the ones who need to call because it's their first baby and that baby cried for 3 minutes and they think this is way out of proportion and obviously they deserve some reassurance. How do you handle that? Can they call your office and you give a full diagnosis as much as possible?
Right. What they do is they always have a support around themselves, like they would have a new mother would have a mother herself within their reach, or a support person, like a person who has prior experience in handling a newborn, and then that would be their first contact. And then sometimes, of course, the symptom exceeds those kind of reassurances, and then they do call the doctor, and we are available 24 hours a day. We are through answering service, and then they contact us, and then we take each contact, phone contact or face-to-face contact, as an opportunity to educate them as to what is important, what are the signs that would make one situation more important than the other. Not every cry, of course, every baby cries, but not every cry is a sign of something great danger. What we try to teach them or tell them to pay attention to is in time, they would learn the baby's cry to be the ones that are associated with the dirty diaper, like when they need to be changed, or the cry that is for hunger cry, the cry that is for in pain cry. When the baby is in pain, then they try those things they do. As they gain a little experience, they check on those things quickly, like they check the diaper to see if it is soiled.
Maybe it's just a cry for attention, right?
That is some babies do that to their parents, and sometimes those parents did that to their parents, and that's a payback. So, yes, some babies are more.
I'm glad to hear here, and I think that's very reassuring. And I'm sure that many pediatricians operate that way. But it's definitely glad to hear that you for sure do that. So, patients, meaning the parents of a patient, can call, and you will then get that thing over the phone, get that answer over the phone, and in most cases you can reassure them that it is okay till next day, and if for some reason you obviously have a feeling it isn't, you will take the appropriate next step and tell the parent what to do and where to go. And stuff like that. And I'm very sure that the parents very much appreciate you educating them, because who wants to be every minute not knowing what it means, what the baby is doing now. So I'm sure they appreciate that education and not look at it as, well, he just wants to get rid of me and not to tell me. No, they go, oh, now I know what it is, and then they can handle it. Again, very, very much appreciated, and I hope the patients get the idea that they actually should call. Well, maybe to a certain degree, as more as they call at the beginning, as faster they get educated by you, and then as a better life they have for the next few years, because they know.
Right.
They got the education.
Right.
Yeah, wonderful. Thanks a lot, Dr. Tural.